If you're planning on going to therapy or if you're a therapist, this video is for you. So I have been in therapy for the last 10 years. I love therapy. And since I moved to Houston, I decided that I was going to do some additional therapy because there's an issue I've been dealing with for the last probably my whole life. And I've done lots of EMDR and therapy like that. But I felt like all of those therapies didn't quite help me with this one thing that I'm like, there's something not right. And so I've got this new therapist who focuses on EMDR and cognitive behavioral therapy. And I was talking to her about the reason why I'm coming to see her. And so I've seen her 3 times and I've told her a lot of things, but she's not really telling me anything. And I was like, how do I feel about this? And so how I was starting to feel was that it just felt like talk therapy, like I was spending all this money out of pocket just to rehash what I felt was going on with me. So I decided to send her an email and I thanked her so much for the sessions that we had. And I said, hey, so the next time we have a session, I would love for you to tell me what is your diagnosis or what are you thinking about when it comes to what my issue may be? Because right now I just feel like we're going around and I'm not really getting the assistance that I need. So then we're having this conversation and I could tell that maybe she didn't really like that what I was saying, but I was very patient and I kept telling her, hey, all the therapies that I've done, what I am noticing about myself for the last 20 years and why I am there with her and what I need from her. And she was telling me like what her typical process is with her clients. And I'm like, I love that. I love your process. But as of right now, I need something else. And so she was like, well, maybe I'll refer you to someone else. So we just kind of was walking through it. And so I started telling her the different symptoms that I have and some of the quote unquote diagnoses that I think that I am dealing with. And once I said some of those things, she said, well, I have been thinking about this and thinking about this, but I still just wanted more time. And I said, okay. I was like, so here's how I am. I don't need to know that I have this or I have that, but I need the communication because without it, it's just talk therapy. And as a result, I'm still with her. The rest of the session was amazing. So for those of you all that are in therapy, it's really important that you are communicating to your therapist all about what you're feeling, what your life has been like. Don't just come in there dumping about situations, but tell them your patterns, what you're seeing is what you're doing over and over and over again so that they can really see the big picture. And those of you all that are therapists, it's really important for you to ask your clients to keep records of what's going on with them, but also ask them, what is it exactly that they need? Do they need to just talk? What exactly is their intention and their need? So I know this was a lot, but I'm getting exactly what I need because I'm showing up as myself and telling her what I need.